What do you have for us
But I
today?
want to talk to you about something new. I tell you this. I love your audience and your questioning, and this isn't just something to rehash old sports medicine stuff. We talk here. I know you know this. We highlight, advances in physical therapy. What's the latest with cupping and dry needling, or equipment that's out there? You push me to find out what's going on, or what are certified athletic trainers doing to keep athletes on the field? What's the cutting edge? And there's some changes in the area of new techniques surgically that I want to touch on this morning. It has to do with high ankle sprains. And, we always hear about it, high ankle sprains. Your audience hears of athletes all the time in the professional and high college level. But we see it all the time in high school, too. This is an injury that crosses across. We start seeing it probably about age 14 or 15 all the way through college and pro. So talking about high ankle sprains, talking about that the incidence is increasing, but we talk about the fact, I guess probably the most recent athlete was Tua, the quarterback at Alabama, and everybody was out of sorts for that 6 weeks between the bowl game, whether he would be ready and all that. He really struggled with his high sprain, so that really kind of brought it to people's front-of-mind attention. But with high ankle sprains, unlike a typical lateral ankle sprain that we see all the time, that's almost never a surgical problem. With high ankle sprains, there really is the possibility 10, 15, 20% of the time where that ligament doesn't heal well on its own, or some of the time where they fracture the smaller bone, the fibula, and it needs to be fixed. And there's a new technique, relatively newer technique, that I wanted your audience to be aware of. So traditionally what we do is we follow these high sprains, and I see them all the time. I have a couple in my practice now where we follow them, we put them in a boot, we rehab them hard, and they're just not getting better. We re-x-ray them, and the space between the two bones, the tibia and fibula, is actually wider, so it's not healing well, sometimes getting MRIs and things. And then we have to talk to our surgical friends. And typically, Ray, what we'd do is we'd put 2 screws across to fix that joint, bring the tibia and fibula back together again. And it was a pretty good surgery that had a pretty good outcome, but it left people with a pretty stiff ankle the rest of their career. And more recently, people have used a very thick wire that is like very thick suture, and they actually put a button on either side of it, tighten this wire up across that space, and I like the name of one of them out there is called Tightrope, and this tight wire fixes that space, but it actually gives them a little bit of motion, because typically you have a little motion between the tibia and fibula when you rotate the ankle, when you're cutting or pivoting or moving laterally. And so in the old days when we had to fix an athlete, they were really stiff, and you could almost see it when they ran and stuff, the stiffness. And more recently, our more up-to-date sports surgeons are doing surgery where they're using this new technique, tightrope for the lack of a better term, because I think that shows in your mind what we're talking about, a thick wire, a thick suture that actually brings it together but allows some motion still in the ankle after we fix it.
Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital. It's amazing how we've advanced in that, Joe.
It is, and there's got to be advances. I mean, this is such a the field of medicine is one of the really fun things to be in whatever way you're in it, as a nurse practitioner or a PT or a trainer on our team, as a orthopedic surgeon or a cardiologist worrying about heart issues. There's always advances in medicine. I mean, it's kind of, one of the things, I go on vacation and, reading books and other things. I read a lot of what's going on in my field and advancement, and because there's always people out there changing things, updating things, and this one had gotten even a little bit away from me, and I really wanted to bring it out to your audience that with high sprains, people hear about them all the time. Coaches hear and they cringe because they know by now that it's twice as long for a high sprain to be back as a typical lateral sprain. We tell them, hey, if they respond to rehab and rest, it's going to be more like 4 to 6 weeks, and I think people see that with pretty significant high sprains, but then there's even that 10 or 20% that don't heal well that now need surgery. But we have a new technique that's been very good, and I wanted to let your audience know about that.
Joe, I saw a lot when I was out there with the Indians again. more and more of this, and you and I talked about this the last couple of years, but it seems like just about every player is going through this now, that cupping, as I'm seeing that more and more of these guys using it, going in. Obviously, I don't see it back in the training room, but as I'm in the clubhouse, I can see the guys coming out with the marks and everything. For my audience that's just jumping on, and when we talk about cupping, talk about what this is for these players and why this type of procedure is really increasing.
Yeah, I love cupping, and I love, in the same vein, dry needling. And you also see a lot of athletes. I mean, you don't go past the game where you don't see that accommodative taping, the bright-colored taping, or it looks like tattoo-type taping. So there's always new techniques out there. We didn't do very well previously when people got into chronic issues of tendinopathy where they would lose some of the blood flow in an area, so then it hurt all the time. And we've been, on our baseball team, lost some people to shoulders, that maybe cost us some championships with Brantley and Zimmer and others with, say, shoulders, for instance. Now a really good technique that helps bring some of that blood flow back is cupping. And so what cupping does is it is supposed to bring some of the blood flow back. And so unfortunately, after you use it, you'll see a lot of bruising around the area where we did the cupping. But in our world, what it does is it brings blood flow back into that tendon so that it can be a good shock absorber and work faster, and so that they can do more in the area of physical therapy. The mainstay is still getting the strength and flexibility back, but this speeds the increase of the blood flow and bringing back these muscles and tendons so that they're more amenable to be rehabbed, so that they're more able to get that strength back in a joint like the shoulder or the knee. And so this is just another example of a really good technique that's been very helpful.
Great stuff this morning, Joe. Good talking with you again. We'll catch up next week.
Thanks, Ray. Take care.
You too. Dr. Joe Congeni, Akron Children's Hospital.